On the phone with us this morning, Yakima County Commissioner Amanda McKinney. Good morning, Amanda.
Good morning. Well, I've been gargling because I'll be testifying this morning on that very subject.
Excellent. Excellent. Will you be testifying with the state, or is this a local thing?
Yeah, no, for the Senate hearing. Yeah.
Excellent. All right. Well, you wanted, hey, we want to say welcome to you, and we want our listeners to know that we're going to be checking in with you monthly from here on out. So you've got some concerns locally about COVID. Tell us about it. What's going on?
Well, of course, we've seen the increase in cases, and we have seen how as the science evolves and our understanding with COVID evolves, the data that seems important to us to understand continues. It's just more and more, which is great. We should, because of course it allows us to really understand, the impacts of the virus, and more and more we're understanding that this is something we're going to live with. COVID is going to be here to stay, and that is widely accepted. And so how do we do that? And I have been just a huge proponent of talking about hope and optimism and understanding the facts and realizing that the data is showing that we have a huge opportunity to just really see the depth and breadth of the virus, and how there are a lot of folks, especially young children, who gratefully are not impacted in the same way as far as significant symptoms and hospitalizations. And so how do we understand, though, that constantly promoting the data, it leads to this sense of hopelessness and continues that fear. So one of the items that has been really significant is that as, of course, we start to see the tests go up, anxiety goes up, all the test positivity. We're literally seeing thousands of people in our county every day test positive. How can you avoid feeling hopelessness? Well, let's focus on the fact that it's still not, though, seeing the same proportion of hospitalizations as we had seen with the previous variants. That's
right.
Good news. So one of the things that California and New York had done is they recognized that there was going to be panic with Omicron if we did not start to differentiate in our hospitalization data who was hospitalized because of COVID versus who was incidentally found to be positive with COVID because they came in and they broke their leg falling out of a tree, and hey, by the way, you're COVID positive. Now, there's been great resistance locally to differentiate that data, which is incredibly frustrating.
Why?
Because
Why?
I will say this. The argument is that it shouldn't matter because it's still a strain on the resources. Absolutely. There is no doubt about it. If we have high hospitalization numbers, whether or not people are COVID or positive, we know that that's a problem. We don't want to see our hospital staff strain more than they already are, especially after the last 2 years. The other argument is that even if they're not symptomatic, they still have to follow protocols for COVID. Isolation, they have to keep them from other patients. Of course, the nursing staff has to treat them differently because they, of course, themselves need to take extra precautions. Absolutely. That is absolutely the case. But why is it important? And I was asked that at the health board meeting when I requested this. What would you do with the data? Well, I know a lot of you listening are like me. You're a parent with young children. And we have come to understand that COVID isn't impacting children as much. But if you look at our hospital data right now, at Memorial Hospital, there are 16 children who've been COVID positive admitted to the hospital this month alone. We've never had that many. So should we be fearful? Should we be wondering, well, wait a second, what's going on here?
Yeah.
Now, don't you think it would make a significant difference if we also were given the information and understood that of those 16, what if 14 of those kids were there incidentally? What if half of them? And the data shows across the United States that anywhere between 40 and 60% of cases of COVID hospitalizations have been incidental. And that's from California, and that's from New York. Those are massive hospital systems. And so it stands to be said that, well, we need to understand this. It's important. Why would we be resistant to understanding the data? I brought it up at our health board meeting. I really hope that we can see the voluntary submission of this data to the public for consumption. It's vital. It's really important for us to understand this. If we have 12 hospitalizations a day and half of them aren't because they're seeking care because of COVID, that's important for us to know. It really is.
As much as they talk about public information and how important it is to follow the science. Well, that's an aspect of science that if incidentality, if you will, is part of the picture, then it's a positive calming message to the public, and that should be something that they shouldn't resist at all, unless there's some advantage to proclaiming COVID. Are we still to the point where if COVID's the cause, that hospitals get more money or anything like that? Is there anything like that driving this possibly?
My understanding is that hospitals still across the nation, that there is still they get compensation for COVID patients. I'm not an expert on it. That would be something we would all be well served to understand from the hospitals. And I will tell you, the reason why this is something that we're trying to drive, and I'm requesting the data, is because it's a private hospital. The hospitals don't have to do this. And, they are in some forms, the HHS.gov does have some information. The hospitals are required, as you can imagine, to report an immense amount of data. And what's confusing to me is that there are hospitals in our own state who are already voluntarily reporting this information. So it's definitely something that's possible. Evergreen Hospital does it on Facebook every morning. It breaks down the vaccination.
Wow.
Yeah. Wow. Every you go to Evergreen Health, they have a Facebook post, and they will tell you the vaccination the vaccination status of every person admitted to the hospital, every person who's in the ICU, every person who's on ventilators, and then they go further and say, and of the 50 people who were admitted to the hospital, 20 of them were incidentally found to be COVID. So there you go. Now you have an understanding. It's really important. And the reason why I'm pushing for it is we've got to move on. We've got to give people hope, especially when we see. I mean, if there's anyone out there, I could tell you there's probably more people on my two hands that I can count that I found out yesterday who had COVID. Right? So we can't have hysteria. We've got to calm things down. We have to understand what this means.
Who's the gatekeeper? Who has to make the decision that says, okay, we're collecting all this data anyway, we will add this to the list that we release? Who's that person?
So it would be the hospitals. Well, the gatekeeper really in this case has been our health district. I started requesting this information over the summer. Health district staff reach out to the hospitals. Hospitals said they're too short-staffed. They don't want to provide the data because they're short-staffed. And, the health district has really been, letting us know and saying, well, we can't force them to, which is true. It's absolutely true. And then at our health board meeting, I made a motion requesting that the health board agree to write a formal letter requesting the documentation from our hospitals. And unfortunately, there wasn't enough support for the motion to pass. And I will say, I think it's because the argument is we're so strained and we just don't have enough time to look at this data to give it to you. And I went so far as to say, I'm not asking for you to go retroactive here.
Yeah.
Just starting tomorrow, let's just figure this out. 12 people walk in. What's the status?
Yes.
And, I think the concern among other folks on the health board is that, we don't want to put an added strain on our medical staff because they're working so hard.
Well,
Absolutely.
That's
a tough call to make, believe me. But this is our community we're talking about. We have to be able to tell parents, listen, don't be alarmed. There's 16 kids in the hospital, but, only, 2 of them maybe are there because they're having COVID symptoms, which, of course, it's important. It does not take away from the fact that the virus is putting people in the hospital who need care. That's not the point. The point is to understand, though, what does this virus do as far as impacting our community?
Yeah.
I don't buy the it's too much work situation. That's, come on. They're already...
Well, I will tell you this. If the New York hospitals can voluntarily provide it to their governor, which, by the way, their Democratic governor told the hospitals in December, we got to know the difference. And they started ponying up with information. Hospitals in California voluntarily did this. And I believe we spoke about this. They started doing this for pediatric cases and doing retroactive reviews of pediatric admissions for COVID last summer, trying to understand this. And they were able to find that up to 50% of COVID-positive pediatric cases in California were incidental back then.
Well, I appreciate the push. It is important information. That distinction is critical for an accurate response to the threat we face, right? You want to be proportional. You don't want people freaking out. So they need to really know what's what. It's not to downplay it. It's to be able to get a proportional reaction to the data.
Yeah.
Right? Right.
That's exactly it. I just want people to really have the data that's accurate so we can walk, especially for parents. You know, there has been, people are so fearful, and of course with another surge, we hear everything. And, you know, more than anything, we know the entire United States, and I would argue probably the global community, we've got fatigue from this. And so we have we've got to take every opportunity to find as much hope and reason to go on as possible. And this is a clear way for us to do that. Here we have this surge. We are moving into an endemic rather than the pandemic. You know, these are things that we should be celebrating that, listen, you know, we've got this, we've got people who've got this, but it's not forcing them into the hospitals. And that is something we need to celebrate.